the SafePod network, and we are going to record this session. So we've got a packed agenda. It's a really busy agenda, so we are going to keep everyone to time. Those speakers will get a warning at 9 minutes. You'll just hear me come on in the first half saying 1 minute, and Serena will do that later on as well for us. I want to thank all the speakers that have come and given up their time, and also yourselves for coming to listen. So hopefully this will give you an idea of what the SafePod is if you're not aware, give you maybe some ideas of potential research projects for yourself or for others in your institutions, and just to really introduce yourselves to that network, as well as listening to some talks from others, so Scottish Government, PHS, ONS and RDS, to just kind of start those brain cells working a little bit so we can go on. So is anyone else having problems hearing me?
I can hear you very well.
Okay. All right, perfect. I think it is just Cecilia at the moment, so we'll let them get that sorted. So right. So we've got a mix of speakers. So I'll just very briefly go through the speakers that we have today, because I won't introduce them at each session, so speakers can just start at their allotted time. So we've got Darren, we've got you, we've got Joe, Antonio, Nadia. We'll then pause at 5 to 3. We will have a chance for probably one question. So if any questions come up when you're listening to the researchers, if you put them in the chat, if you like the question, put a little mark on it, and I'll choose the most popular one. We'll ask that, and then any other further questions we'll put to the speakers, and we can send around their answers afterwards. We'll then take a break at 3 o'clock, and then we'll be back sharp at 3:05. And we'll have Jamie, we've got Sahil, Phil, and Jen. And then at about 3:45, there will be a chance for people to ask some more questions and have a bit of a discussion. So unless anyone has any questions, we're maybe good to go. So Darren, I'm going to give you an extra couple of minutes. So
oh, brilliant.
If you want to start, let's keep us going. So Darren, if you share your slides and we'll get started.
Okay. Okay, so good afternoon, everybody, and welcome along today. My name is Darren Lightfoot. I'm the SafePod Network Manager, and I'm just going to give you a brief introduction to the SafePod Network. So we'll cover our main aims and objectives, how it all works, and then we'll look at some developments as well. So SafePod Network, it's a major research innovation in the UK that we provide researchers with standardized safe settings that we call SafePods for data that requires secure access for research. And we're part of the Administrative Data Research UK programme. So historically in the UK, the main barriers for data access from safe settings were there was generally a lack of availability. There was limitations on researchers' time, cost, and distance to be able to get to safe settings. It was fragmented, so it was a one-to-one model. Research could only go to a particular data center's safe setting, and the infrastructure was limited to data centers that could build their own safe settings. So we're looking to overcome all of those historical barriers, and we want to enable access to multiple data centers' data from the same safe setting. And we want to be able to ensure that researchers all across the UK have equitable access to data. And we also want to improve and widen the sharing of data center data for public benefit research. So hopefully by achieving 1 to 4 of our objectives, we'll significantly improve the quantity and diversity of public benefit research. So this is a SafePod. As you can see here, it's got a researcher area inside. We've tried to design it as nice as possible, really. So it's a small prefabricated room, and it provides all the security controls necessary for researchers to go and access sensitive data. Main features are as follows. So we've got the researcher area there I've just shown you. There's a secure cupboard for the storage of our equipment. We have a CCTV camera inside for monitoring. There's a door access control system, emergency and fire alarms, it's wheelchair accessible, and we've really designed it to have a pleasant working environment for researchers to be able to work in there for long periods of time. There's also a height adjustable desk you can stand, sit. There's 2 large screen monitors inside, and up to 2 researchers can use it to access the same project. There's also a writing panel for making notes, a personal locker on the outside, and a telephone on the inside as well. So the main purpose of the SafePod is to provide local access to data for researchers to different data centers data. And to date, the following data centers have joined the network. This includes the UK Data Service, there's a secure data lab, the Office for National Statistics, their secure research service, Sale Data Bank, all linked data sets created through the ADR UK programme, Scottish Government, National Records of Scotland, Health and Social Care Northern Ireland, and most recently the Leeds Institute for Data Analytics. We're open for other data centres to join, but the main benefit for data centres is that as all SafePods are the same, all policies are the same, then accrediting one SafePod accredits all the SafePods across the network. So here's how it works. There's no data that's held inside a SafePod. Instead, we have a computer, has a secure connection, and then it connects out to the different data centers' trusted research environments. We have 4 main security principles. These are safe researcher, so you must pass a training course, an online training questionnaire, sorry, before you can book and use a SafePod. There's safe access, which is we have local coordinators manage each SafePod. Safe data, so that's the IT system I've just shown you. And safe analysis, so that's the SafePod and the camera and the door control system inside. And surrounding all of these are our standardized policies. We have 23 SafePods across the UK that are live and available for booking. There's a further SafePod at the University of St Andrews, and you can find out more about each of them and their contact information from our website. So just wanted to give you a little note on SafePod coordinators. So they're a local team that are responsible for the security and operation of their SafePod. They must manage it in line with our policies and procedures. They're background checked and trained every 3 years, and they're the people that meet and greet the researcher and show them to the SafePod and complete the necessary security checks. They're on call if needed. We have over 180 coordinators across the UK, and there's also an awards scheme available to them as well. Okay, so here's really a quick diagram at how it all works. The researcher and the data center, there must be an approved project in place between them. They then both must have joined the SafePod network. The researcher then goes and books a SafePod from our website, and this request is then sent to the data center. And providing they approve it, then the researcher can arrive at their chosen SafePod and then go ahead and access their project data. And just to say that a data center sets all the access conditions to a SafePod for their booking, so it very much becomes their own safe setting for a booking. So they determine who can enter, when, what can be taken inside, how a mobile phone can be used if needed. I just wanted to also flag up that SafePods are also available to organizations for local confidential projects. So if you have a project in mind that requires a safe setting, then please get in touch and we can have a chat about that. This is our website. This is where researchers register and make bookings. It's where coordinators manage their SafePods, and it's where data centers approve or decline bookings for them. So just thought I'd give you a quick bit of information on how researchers make SafePod bookings. It's really simple. You register, you pass a short training questionnaire on our policies, select the SafePod you want to use, select the data center, the dates, provide your project title, and then that all gets sent off to the data center for approval. Here's just a quick screenshot of our bookings calendar. You can generally book mornings, afternoons, or all day. And then on the day of the SafePod booking, the researcher just goes to their location. They'll be met by a coordinator who'll carry out an identification check, which is a driving license or passport. They'll give you a SafePod induction if you've not had one before, and then you can just go ahead and use the SafePod to connect and get access to your data. There's a menu inside the SafePod, so you just click on the data center you want to go to. It then goes to their entrance page to their trusted research environment. And then you just enter in your project credentials, and that will give you access to your project area within the data center. So it's all really simple. Just a note to say that all programs and software are held by individual data centers in their remote desktop environments. We don't have any data or software held inside the SafePod. For urgent or critical research, we have an application procedure which will enable you to use a SafePod for long or continuous periods of time. So again, just get in touch with us if you need to do that. As data centers provide their data remotely to SafePods, we have various assurances that we provide to them about SafePod locations, coordinator details. Each booking also has a security report that needs to be completed, and this can be viewed by data centers as well. We have incident management procedures, and as I mentioned, they can set up their own security and access conditions to the SafePod. And there's the CCTV system inside as well. And this is just a quick picture of what the CCTV displays. This is monitored by the SafePod network, and then any incidents are reported back to the data center for their own investigation. Just briefly on statistics, we've got 500 registered researchers. We've got 180 SafePod coordinators, as I mentioned, and 7 data centers that have joined us, and we're hoping Public Health Scotland will be joining us shortly. And researchers are making around 350 SafePod bookings a quarter. Okay, so that's SafePod. So in development, we've also got SafePoint, which is a new standardized system for providing secure access to data using a custom-built desk from within an approved room. It has all similar security controls to a SafePod. It's low cost. We can scale it, unlike SafePods, to enable any research organization in the UK to have their own access point. And we're hoping to release a funding call in the summer. And yeah, just to say as well that LEADER have joined us in providing access to their data for their research through the SafePod network.
1 minute.
Thank you. And we also have we're hoping to have a ready-made solution which will enable researchers to deposit data into LEADER as well, and then be accessible from SafePods. We're also looking for an international project, so that's to access international data from SafePods. If anyone's got any projects they would like to discuss, just get in touch as well. And just to conclude on impacts, so we're providing research with local access to data. We're enabling access to different data centers from the same SafePod. We're encouraging research, and we're widening access to data, and we've got this partnership with LEADER as well. We'd just like to acknowledge our funders, the Economic and Social Research Council, for providing the funding and support for the SafePod network. And
Perfect.
here's my contact details. Thank you.
Perfect. Thank you very much. Okay. Thank you. If we ask the next speaker to start showing this slides, please.
Can you see this okay?
It's just loading. Yeah, you just need to put it into presentation mode.
Presentation. Can you see this now?
if so we've got it as presenter. So if you just click on display settings and just at the top and just switch it across, yeah.
Display setting. Where would that be?
So
Top left.
yeah, top left. If you just go up to the top a little bit further, and then one along, across a little bit into the middle, it says display settings. If you just click on that,
Display setting.
just there. If you click on just where your mouse pointer is, if you
Top left.
so up a bit, just where you were, but it's in the middle. It just says display settings. So you've got show taskbar, and then you've got display settings just towards the top. So across to the right a little bit.
Yeah, this mute, stop video, participants, chat.
Oh,
mute
so
show.
it's obviously hidden it. And
Yeah, it's not showing on my screen.
okay, because it's showing your mouse pointer there for you.
I think that should work. It's just
Yeah.
9 slides. Thank
Yeah,
you.
so if you just want to start, we can see the slides, so go for it.
Okay. Okay. Great. Okay, so hi everyone. Thanks for the opportunity to speak about my research. This is a joint work with Lual Hati Santiago from Office for National Statistics. And it's a project on the social integration of immigrants in the UK. Here's the outline of the talk. So I'm going to very briefly talk about what our research is about, the data sets used in this project. And I'm going to very briefly summarize the key findings of the project and the publications. And the last point is the focus of this webinar. I'm going to be talking about how I access the data and how SafePods helps our research. Okay, so what the research is about. We live in an increasing diverse society, and social integration of immigrants is an important policy objective in many developed countries. In order to promote integration, policymakers need to understand what barriers immigrants face to integrate, and our project focuses on one of the possible barriers, English language skills. There is extensive research on the effects of language on labor market outcomes, such as earnings, but there is limited causal knowledge on how the language affects residential integration, health, and family structures of immigrants. With this in mind, our aim is to contribute to this knowledge by estimating the causal effects on the causal effects of language skills on a number of residential location outcomes, as well as education, health, and fertility outcomes of UK immigrants. Let me be a little bit more specific about what outcomes we study. So broadly, we have 4 categories of outcomes, and we analyze the causal effects of language skills on first residency in 4 different types of immigrant enclaves, namely ethnic enclave, language enclave, country of birth enclave, and world region of birth enclave. Distinguishing different types of enclave is important because language skills can have different effects on different types of enclave. For example, immigrants fluent in English may live outside of a language enclave if the reason for living in an enclave is simply for linguistic convenience, but immigrants who are proficient in English may decide to live in an ethnic enclave if they value other aspects of living in an enclave, such as availability of job opportunities, better job opportunities. And the second outcome we study is the extent of deprivation in the neighborhoods immigrants live in. And this allows us to examine what kind of residential environments immigrants are living in, depending on their English skills. And the third outcome is the fertility outcomes. And we study some fertility outcomes that haven't been studied before in the context of the causal effect of English language skills. And the last point, we also study educational attainment and self-reported health of adults. Now, which data set did we use for this project? So the main data set we used was the Office for National Statistics longitudinal study, which contains individual level data from the England and Wales 2011 census. And this main data set is linked to various different data sets, and we made use of two other linked part of data sets. The first one was indices of multiple deprivation, measuring the extent of deprivation in neighborhood along multiple dimensions. And using this allowed us to analyze the residential environments immigrants are living in. And another linked dataset we used was live birth to sample mothers, which contains life event records of sample women in the longitudinal study. And this allowed us to study fertility outcomes for women. And very quickly about key findings. So this slide is on key findings on residential outcomes. And we have found that better English skills led migrants to live outside of a language enclave, which is probably to be expected. But better language skills led them to cluster in an ethnic enclave. And we find that an important and interesting result. And it shows that distinguishing different types of enclave is important because the effect of language skills can be different. And second, we have also found very strong evidence that poorer English skills lead migrants to live in a more deprived neighborhood. And the paper that contains these results was published in Journal of Economic Behavior and Organization this year. And here's the second set of results on education, health, and fertility outcomes. And we have found that very strong evidence for better English skills to improve educational attainment. And we have also found that it improves adult health, but not child health. And the last point, we have also found that poorer English skills lead immigrant women to have a higher chance of becoming a teenage mom. And the paper that contains these results was published in Labor Economics in 2018. And we have also produced a policy report that is targeting a lay audience. And we published it as Health Economics Research Unit Policy Brief in 2016. Okay, so here's the main focus of the webinar. How did the SafePod help my research? And in order to answer this question, I would like to start by talking about how I was accessing this data before SafePod became available. And before SafePod time, I was traveling to London or Ferrum to access the data, and it was a significant investment in terms of time and money. And I find that it can be a serious barrier to data access if geographical mobility is restricted. And I think that there were big inequalities in data access opportunities depending on where you live, as well as depending on your life circumstance. And whereas after SafePod became available, it was really life-changing personally, because the confidential data can be accessed from a remote area in a safe environment. And availability of SafePods opens a door to accessing confidential data to those who have restricted mobility due to, for example, caring responsibility. And this applies to myself. I have 2 little kids, and it's very difficult to be away from home for a long period of time or to be away frequently. But,
1 minute.
Okay, thank you. Excuse me. But SafePod helped me continue engaging in research without any unnecessary delay. And I also see that some senior members of staff have caring responsibility towards their parents, and that can restrict their geographical mobility. And in addition to that, I'm going to add disability and budget limitations as possible reason for restricted mobility. And as I mentioned earlier, traveling to London and Ferrum frequently was really not only time consuming, but it cost me money. And if you have budget limitations, this can limit your access to data. But having SafePod close by lowered a barrier to data access. And as a result, it mitigates inequality in data access opportunities and possibly allows people in different life circumstances to engage in possibly high quality research. Okay. That's all from myself. Thank you very much.
Thank you. Thank you very much. That was great. Would the next speaker like to share their screen?
Joe Harrison, are you
Yeah,
here?
he's just sharing.
Okay.
There we go. Just need to pop it in presenter mode, Joe, and then. And again, if you can just switch on display settings, so just cross one if you can see it. Yeah. And
What, presenter view and slideshow?
yeah, if you just do that, there we go, perfect.
Yep, perfect. Okay, great. There's no notes anyway, so you wouldn't for anything. But yeah, hello. Thank you everyone for joining today. My name is Joseph Harrison. I am a PhD student close to finishing at the University of St Andrews. This is a paper I've been working on through the University of Dundee SafePod on cancer incidence and mortality in Pakistanis, Bangladeshis, and their descendants in England and Wales. And I will share what I've been doing and why now. So health of foreign-born populations and minorities is becoming increasingly important for long-term health policy. The UK, England and Wales is a country of migration these days, and those migrants are now starting to old, age, and sadly die. And as the ethnic minority and migrant population increases, the healthcare burden might change. And if there are different health implications on migrants, our future planning needs to take account of that. What we do know is that migrants generally have a mortality advantage, but that doesn't necessarily mean they are healthier. More and more research is coming out suggesting that they spend longer time alive, but a bigger proportion of their life in bad health. Much of the medical literature in the UK focuses, though, on ethnic differences, neglecting possible differences between generations of migrants. So we see this migrant mortality advantage, but for the children of migrants, it may be different. And in general, Pakistanis and Bangladeshis continue to be the most marginalised immigrant and ethnic group in the UK. Residential segregation, labour market segregation continue to afflict these groups, and that persists at migrant level and for the descendants. Migrant cancer has been studied across a variety of situations, but one of the biggest things is the rapid health transition. Migrants, particularly from poorer countries, enter Western industrialized nations and quite quickly benefit from a lack of infectious diseases and better health infrastructure. But some risks for factors of cancer remain inherent in their genetics. Things like liver cancer because of hepatitis remains a risk for people from Pakistan and Bangladesh. But in theory, lifestyle-driven diseases, which is most cancers that we get in the West, will increase following migration as adaptation and acculturation to Western norms, so high levels of drinking, high levels of smoking, worse diets, they should all increase and in theory would increase cancer rates following migration. The previous work finds global cancer patterns are changing. Lower middle income countries are starting to adopt these unhealthier lifestyles. So the timing of migration is a relevant part of cancer burden over time. In the UK, Pakistani and Bangladeshi mortality is lower and is generally driven by lower cancer deaths, we believe. But we don't know if lower cancer deaths are because of differences in cancer mortality after getting cancer, or they just aren't getting cancer in the first place. And that's what I'm trying to do with this research, is separate out the incidence of cancer and then subsequent mortality. I'm also looking at the generational effects and seeing if the differences between the immigrant generation and the children of immigrants can identify some assimilation effects over generations. And people are starting to study the descendants of immigrants more. It has been limited previously because of the age structure, but now they're starting to get older. This is becoming more possible. Some previous research from Matthew Wallace has found that this migrant mortality advantage is lost for descendants, but it hasn't been able to be specific about origins. And that's what a lot of my PhD does. There's this chapter, but then my next chapter, which is someone else. The ONSLS is what I use. You've done a good job of introducing this, but it's a census-linked life events record. It's about a 1% sample of England and Wales based on 4 undisclosed dates of birth. And you can enter the study as a new birth, as an immigrant, with one of those birthdays. Immigrant entries are based on NHS registration, which is also how they get information about cancer incidence and death. So I use this to isolate the Pakistanis, the Bangladeshis, and ancestral white British population. I require people to be in at least one census, born 1920 or later. The sample is quite healthy. It's about 463,000 in total, and about 5% of them are Pakistani or Bangladeshi. I use event history analysis to do this. I have 2 sort of models. The first, or 2 sorts of analyses. The first one predicts a cancer diagnosis following the age of 20, and the second one resets the clock from getting diagnosed with cancer and follows you until death over the next 10 years. I then use Cox proportional hazard models and stepwise modeling to include the covariates to sort of isolate if socioeconomic and socio-demographic characteristics are relevant to this. So the covariates, I have to control the time because of changes in healthcare infrastructure and detection of cancers, and also the migrant cohorts. I control for location, social class, and education, and also for tenure and marital status. So the first output is the incidence of cancer. This shows the hazard ratio of cancer incidence for Pakistani-born, Bangladeshi-born, and descendants. The reference category is 1. Oh, here we go. The reference category is 1. If it crosses 1, it's not statistically significant, and that represents the ancestral British population. As we can see, low cancer incidence is sustained between Pakistani-born, Bangladeshi-born, and their descendants, and the inclusion of socioeconomic variables does not really change this. The risk is about 1/3 to 40% across all the groups. It's a much lower risk of cancer incidence for these people. It isn't the same for mortality, though. Post-diagnosis of cancer, the risk of mortality is non-different from that of the native British when it's fully controlled. Here, we also use a control for the type of cancer because it likely matters, and it does do a lot of, when you control for that, it does change a lot of the outcomes. This implies that the descendants are potentially getting more aggressive cancers in early ages than the white British population, which is something to be aware of as we move forward in planning healthcare outcomes. A lot of people then now ask, is the low incidence because the unhealthiest members of the Pakistani community have already died? The answer is no. When I look at the risk of mortality before getting cancer, the risk is still lower for Pakistani and Bangladeshi. The migrant mortality advantage is definitely sustained, and it isn't a reason that they're not getting cancer because they've already died. I've checked this. So there are clear differences in this onset, but not in the 10-year survival post-diagnosis. Why we think this is? Probably because of the maintenance of healthy habits. The Pakistani and Bangladeshi background, most of these people are Muslim. Lower smoking, better diets, less drinking is likely a big factor in why cancer is not as prevalent in this group, and why it assimilates differently to descendants, because they are more likely to partake in all of these activities. Also positively selected. The healthiest people from Pakistan and Bangladesh are the ones who migrated, even if their experience in the UK has been fraught with racism, discrimination, and labour market segregation. They are still the healthiest who have made that journey in the 60s when the migration streams were happening. Underdiagnosis is possible. This is hard to capture. I'm never going to know if people have died with cancer without being diagnosed. There is a lot of research about accessing screening programs and things like that, which could be part of the story, which I can never really tap into, but it is possible.
1 minute.
Yeah, that's fine. Potential good outcomes is that healthcare access actually equalises survival after diagnoses, that the NHS isn't causing issues, that universal healthcare is treating people equally, and once they get cancer, there's no significant differences in who is unfortunately dying. And then, yes, I believe that this is suggesting there are more aggressive early life cancers amongst defendants, like I said. I've done plenty of robustness. These models aren't sex stratified, but they could be. There's so many different ways of selecting samples. People like to change their mind about their ethnicity and their country of birth. I've done all sorts of sensitivity analyses to check this out. It doesn't really matter. The results do hold. I've got lots of missing covariates as well, including and excluding them. It doesn't really matter. And I've checked for the age structure as well. But if you have any other suggestions of where it might have gone wrong, please let me know. But this is the main takeaway, that low cancer mortality in Pakistanis and Bangladeshis in England and Wales is driven by low incidence, not differences in survival after diagnoses. But thank you for your time, and I can only reiterate what you said about the SafePod as a whole. It's been very, very useful. I wouldn't have been able to do this research without having the SafePods, because going to London would have been too extravagant. But yeah, there's the necessary acknowledgement as well.
Perfect.
Thank you.
Thank you very much, Joe. Antonio, do you want to share your slides? I know there's lots of questions coming in, which is
Oh, yeah,
great. So just
please.
keep
I'll
popping them
reply
in.
in the chat as well to any questions.
Yeah, if you just keep your questions coming in, we will ask one after break. But Antonio, that's looking great. Should be able to see things in a minute. You just want to pop it into presentation mode. Thinking about it, don't worry. Ooh. You know what, your slides are big enough. Do you maybe just want to start talking and you can just click onto the individual slides as you go? Do you also just want to check your sound? I can tell that you're off mute, but we can't quite hear you yet. Oh, right, we can now see your slides. We still can't hear you, so if just at the top, if you just want to click in the middle, display settings, so over to the left, sorry, left middle. That's it, perfect. And just switch that to, that's it. And just to confirm, you're not speaking yet, Antonio, because we still can't hear you. No, we just get a little, we can see you go green, but we get a little bit of a sound. Okay. Right, so we mix this up. Who's my final speaker? Nadia, are you ready to go? And then we can maybe just let Antonio leave and come back and see if that fixes the audio. Okay, perfect. Thank you, Nadia. Do you want to share your screen for me?
Yeah.
Antonio, if you maybe just want to leave, which you might have done, and just come back, that'd be perfect.
What can you see? Can I ask?
If you just want to go into slideshow now, that'd be good.
Slideshow.
Just where you were, yeah.
Yeah, there it is.
And then, yeah, just switch it around.
Switch it around. Okay. Yeah. So, is that okay?
Yeah, that's perfect. Thank you, Nadia.
Thank you so much for giving a chance to speak about research and the user experience of SafePod. We are working at Durham University School of Education and Durham University Evidence Center for Education, which is our team is mainly known for working in the area of large-scale data sets, combining data sets, and trying to understand the disadvantage in education, disparities in education, and what can make education a prolific thing for children coming from poor backgrounds. So I'm Nadia Siddiqui. These are my details. If anyone wants to contact me regarding the research I'm going to talk about today, and or in general experience of applying for data sets in education and accessing them through provisions like SafePod. I would be very happy to share my experience and some learning that I have got in the last few years. And yeah, this is the work, and I'm going to specifically talk about 2 projects today that have been funded by funders from the Department for Education. And we have been given funding to analyze 2 very important data sets, which is basically an evaluation of a nationwide rollout of a scheme funded by state, which is known as Pupil Premium. Pupil Premium is funding given to schools in relation to the number of disadvantaged children they enroll, and linked with that specific disadvantaged child, each school receives a certain, quite a good amount actually, for their educational improvement outcomes. So this program was implemented in 2010. It was rolled out nationwide in 2010-11 onwards, and they were interested in how Pupil Premium funding, or basically funding schools for disadvantage, can it lead to improvement in outcomes at Key Stage 2, which is end of primary, and Key Stage 4, end of secondary school. And that's the information that we achieved from National Pupil Database. And it's been given, we have received access for 2008 to 2019 years of data. It's a large scale data having a lot of information about children that is administratively recorded through school census. And we have access to another data set, which is pupil parent match data, which is PPMD. And that is basically answering the question, what if we assess the outcome of this program, replacing the indicator that we have traditionally used, which is free school meal. So the second question is, can household income explain poverty and its impact on educational outcomes better than free school meal indicator? So which is like much more detailed information about household and their characteristics, and telling us much more information about the depth of poverty in which children live. So these 2 highly sensitive data sets have been linked for this project. And we are very lucky to have achieved this data set for analysis and answering very important research questions that can make policy level impact. So after combining them, which is a big task, it's millions and millions of cases, we are trying to see a regression discontinuity trend before 2010 and after 2010, whether it has improved disadvantaged children impact of the pupil premium on disadvantage after the rollout of the scheme. And this is educational outcome is one of the outcome, but we are also interested, has it improved the level of segregation in state schools in England? Our schools becoming more mixed, because now each child coming from poor background is not just a poor child, that child is also bringing money to school. So has it led to any changes in pattern of segregation? It has. We have published some findings. It's an ongoing work. I won't say that not before getting this funding we haven't worked on this area. We have had a good amount of work done in the area by using small scale data sets such as survey or longitudinal studies, and that provides the basis of our work. The second project that we have, SafePod user experience, is funded by UKRI, and it's basically asking the question to what extent ethnic composition of the teaching staff in schools in England explain the attainment of ethnic minority pupils at Key Stage 2 and Key Stage 4 results, primary and secondary results. And here again, we have a national pupil database, highly sensitive information about children, their individual characteristics, their performance in national exam, attendance, exclusions from school, and their characteristics. And we have linked it with another school workforce data, which is available at individual level. And we have linked these data set means DFE has allowed us to link these data sets, and it's anonymized in a secure environment. We can see whether individual teacher characteristics such as where they are deployed, what's their ethnicity, what's the training type, what's their age, experience, employment contract, has any link with disadvantaged children or children with ethnic minority backgrounds, attainment outcome. We have also done some analysis of how promotions are. There are disparities in promotions of teacher or the nature of contract they get when they get into job, while just looking at this workforce data. And as you know, teacher retention is after the COVID time period, retention in school is a big challenge. A lot of teachers are leaving the job, and we want to address that level of impact on what can policy do to prevent that effect of teacher workforce and improve teacher workforce, and they can retain longer in the pipeline of teaching. So this is a new project basically, and we have published some outputs based on pupil characteristics and the level of segregation and outcomes, and linking it with teacher workforce and assessing exclusions. And that's something that has interesting findings. It's available, and when you get the slides, you will be able to see the results. Here is the SafePod at Durham University. I'm entering the SafePod. As a user of this facility, I would say I'm very satisfied. And I am not a regular user because academics have access to this data on their machines, secure machines, which goes through a lot of process of checks. But when I used it is the time period when our offices or the buildings were changing from one location to another location. So we were moving offices, and there was no chance to access the safe environment using our secure access machines. And that was the time when I had access to data, because each project funding is limited. We cannot afford any time period of not doing any work. So having SafePod available there saved a lot of our time. And we continued working as we thought we were working in our private spaces, which have been checked for accessing data in secure environment. The environment is very comfortable. We are 4 people who are actually good user of SafePods. And all of our experience is the environment is very helpful. Once you are in SafePod, you are completely disconnected. It increases your focus in work, and you're completely disconnected from world outside. So you can't take your mobiles unless you have multi-factor authentication compulsory for some access. But outside, after then, you cannot use anything, any link outside.
1 minute.
And you're focused on the work. And I would also say one very important aspect, that it's not only for academics, it's for member of the public as well. So we are very proud of the fact that member of Durham community or Northeast community, people working in local authorities or in NHS work, if they get access to this data, this facility is available at Durham University for them to come and work here and analyze data, see how it can benefit their organization. So it's not only for academics, it's for wider public as well. And the process is very, very easy. And obviously the funding does not allow us to travel to London all the time. So having SafePod is an amazing facility, and it saves time during transition period, or periods such as they were lockdowns, then you can't get into office or any of the public spaces. So obviously SafePod is available there, and it's an alternative for us, and some of us depend on it unless our secure machine environments do not get approval. And currently my colleague who hasn't got access for his machine is currently working in SafePod. So thank you very much.
Perfect. Thank you very much, Nadia. That's great. Antonio, do you want to let us know if your mic is working?
Stop sharing. Stop sharing. No, can't share.
Not quite. Antonio? Still can't hear you, Antonio. Okay, great. Whilst we have some technical issues, we will very briefly, there's a few questions in the chat, and I'm really mindful I want to give people a break, but we've got a little bit of time afterwards, so we'll try and just get Antonio sorted during the break. There's lots of questions that have come in. I think some are very specific to researchers, some are probably more specific to the data providers, so sort of the data information that they have, the data software that they have available, whether you can connect to internet, how easy it is to get additional data. So I think the question that got the most likes, so we'll go to you. You're going to get the question, and that was from Andrew, and he was asking about what level of data the SafePod allowed you to work with versus what was available to you outside the SafePod. So around that ethnicity and language proficiency, what level of data was it? Are you able to answer that, you?
Sure. So it was an individual level dataset that I was accessing from outside SafePod, and had it not been in SafePod, I couldn't access the data at all. So as I was saying, before SafePod time, I was going to Ferrum, where ONS is located, to access, or ONS office in London. And apart from that, I couldn't access at all.
Okay, so patient level, perfect. We've got time for maybe one more question. So Sarah, you've just popped one in, so it's going to go to Nadia, I think. And that you were asking about the teacher workforce data and whether that was available in the database that had been collected, or did the SafePod allow different data linkage between different databases? Nadia?
So thank you. It's a good question. So the linkage happens at organizational level. SafePod is only providing an access to what already you have linked and got approval for. So that access part or application for applying for accessing that data sets is a different process. And once you get approval for those access, SafePod is a point for you to go and work in it. So these are two slightly different things. So it's not SafePod that links data for you. It's not SafePod's work. SafePod is only a place where you can access highly secure data for which you have already got approvals, linkages, and you have passed all the process. I hope I'm clear. Can anyone else wants to come in here?
I think, yeah, that answers the question. So I think also, Sarah, then it would then really be dependent on the data providers that you were getting the data from, whether they would allow that linkage between the different data sets. So another question that came up was about how long did you need to spend in the SafePod? And I know, Joe, you've popped into the chat that with ONS, you could ask them to transfer files in. Do others know roughly how much time they spent in the SafePod, like a rough estimate? Nadia, do you know how many hours you spent in the SafePod?
I've spent hours and hours. There never has been a problem. You can access it, but the space is very small. It's a pod only. So only two people can fit in, and it's basically at one point only one person is allowed to use. So it's very comfortable environment, very posh chairs, very fancy screens, and the experience. I mean, it's sometimes I would feel like just going there to change an environment for office and to get away from students, or students can't. If I'm in SafePod, then I'm completely disconnected from the world, and students can't come in there. So yes, hours and hours, and there is no problem in accessing it. There are no timelines unless somebody has got a booking after your slot. Then obviously you will have to leave, and so I don't see that timing as an issue.
And I think, Darren, that's why it's really useful, isn't it, having SafePods in different locations, because it does make it more accessible to people that they can use it quite often. Okay, I'm mindful of time, and I also just want to give people a chance to have a break. So there's lots of questions in the chat. So what we will do is we will collate them all and send some responses around afterwards as well. And like I say, there's a few I think that are for provider specific. So we'll see if we can get those answered in the second half of this. Great. So what we'll do is we'll break. We'll come back at. Shall we come back at 3 o'clock, Serena? Just a 5-minute break.
That's okay.
Yeah, hopefully, I think all the afternoon speakers on the call, so hopefully they don't mind starting. So if you want a 5-minute break, if you want to switch your cameras off and go have a quick break, we'll be back at 3 o'clock. Antonio, do you want to just stay and we'll see if we can get your sound working?
Right. Jamie, are you there? Happy to start sharing. Jamie?
Hang
Hey.
on, I am here.
Okay.
I'm last minute panicking. Is it just us? Yes. Oh no, is everybody gone?
We can hear you, Jamie.
Good.
Or
I'm just
whoever is
trying to.
on.
I know. I'm just trying to see if I can switch my camera on. Sorry, I am not used to Zoom, but it's not letting me. So, is this us starting our presentation? Is it, Rebecca?
Yes,
A
if you'd
presentation
like
for
to
you if
share
you
your
wish.
I thought we were
screen.
having a break. Sorry. Now I am hitting. Right.
Here we go.
Okay, great. So is it in presentation mode?
It is, yes.
Okay, great. All right. Thank you everyone for your patience. Like I said, very sorry about that. Don't know what happened. Nevertheless, my name is Antonio Hager. I am a final year PhD student at the School of Health and Life Sciences at Glasgow Caledonian University in Glasgow. And my presentation is going to be about the application of machine learning to long COVID, and specifically looking at how it can actually be classified. So just to get right into it and give a very brief overview, I will be giving you a background and rationale to my project, followed by the role that SafePod and SAIL played in my research, followed by some key dataset characteristics. Then I'll go into some preliminary findings, and finally, obviously, if there's any questions, we will deal with that afterwards. So why was I interested in looking at what would seem to be a very timely topic of long COVID, despite the fact that there is already a lot of research? Um, Data shows that as of this year, 2024, there are at least 774 million recorded cases of COVID-19. That's the disease of COVID-19 or acute COVID-19 across the entire world. Of course, this is only including cases that have been registered with a healthcare provider. So there's obviously many more that have not been counted, including asymptomatic cases. And as well, there is at least 7 million known deaths from COVID-19 that have been attributed to it either directly or indirectly. Um, Furthermore, last year, 2023, in Scotland, a group of researchers found out that at least 12.8% of persons who had been diagnosed clinically with COVID-19 had continued to experience what would be termed as residual symptoms up to 12 months after the initial acute infection. And of course, residual symptoms in this case being a very broad catch-all term for any symptoms that they either displayed during the acute illness or that they developed subsequently after the acute phase of the illness. This is where my research question comes in, because many researchers even now would classify long COVID as basically being another form of post-viral syndrome. In other words, you caught a virus and then afterwards the symptoms from the viral infection persisted. That's one train of thought, but another school of thought is that essentially it can be classified as a single etiology. In other words, this in this case being the SARS-CoV-2 virus having or displaying multiple symptoms throughout the course of the entire disease or throughout the aftermath of the disease. And so one thing that both of these schools of thought have in common is the fact that they stress on a predetermined set of symptoms and outcomes. So there's a list of certain symptoms that the patients are believed to be suffering from. And then the research then tries to match up and see how many of these symptoms are actually being displayed in a particular population. My approach is different in the sense that I will be using machine learning not to use a pre-existing list of symptoms that have been defined by the WHO or NHS England or Scotland, but rather by trying to use the data to actually come up with an organic new definition of what a long COVID is based on how symptoms cluster. Which brings me to the two major backbones of my research. The first one being the SAIL data bank, which has provided the data for me to use with this. And I'll be going more in depth into what particular data sets I'm using. And of course, it goes without saying the SafePod, which was essential for me to actually start working with this data set. So what specifically drove me to get into this? Well, GCU is actually one of a few universities that were spearheading the use of the SafePod network. The SafePod at GCU has been indispensable when it comes to actually providing a safe and secure environment, especially with the very sensitive patient level data that I'm working with. And particularly, I've been using it in the beginning of my research when I had to look very carefully, doing a lot of descriptive analysis and exploratory data analysis. And it will, of course, come in very handy towards the end of my research as well when I'm trying to actually evaluate models. I need to spend a lot of time in a very quiet and secure environment to actually run these models and then look at the outputs. So the SAIL database, just to give you a very quick overview, contains patient and subject level data from NHS Wales, as well as other studies that have been carried out across the UK. Sorry, that should be the UK, not the UN. And the data is both cross-sectional as well as longitudinal in nature. In my case, I am focusing mostly on longitudinal data. So what are the primary characteristics of my data set? So it was a very, very large data set that actually goes all the way back to records that stretch back to 1912, believe it or not. However, for my purposes, I decided to define a 5-year window as my background data. And so for that reason, I determined that I would use from the 1st of January of 2015 up until the 31st of December of 2019, which basically was the period up until when the COVID when COVID pandemic officially was established within the UK, and when the first index cases were actually notified to the NHS, and this gave me a total of 1,518,599 unique individuals in the pre-pandemic period. Following this, my pandemic period basically ran from the 1st of January 2020 up until the 30th of August 2022. That's the data that I was given access to. And this included 828,428 unique individuals. Again, this came from data from NHS Wales. And one of the things that I'm primarily looking at, among other factors, is the length of stay in hospital, which is very key to forming the backbone to models in terms of looking at what could potentially be the etiology or the cause of long COVID, or what could be considered, within the cluster of symptoms considered for long COVID. And so I calculated the length of stay in hospital by basically subtracting the date when the person was first admitted from the final date. And this gave me an average of 3.22 days in the pre-pandemic period, followed by 3.39 days in the pandemic period, with an increase of 5.28% during the pandemic period. Now, for those of you watching and looking at the stats, you may be wondering why I decided to use the mean instead of the median, which is more robust. The reason for this basically was that the median essentially in the majority of cases came close to zero. And so the mean was a much more useful number for statistical purposes in my case. And in terms of the specialists that were seen by patients while they were admitted to hospital, the most common ones, both pre and during the pandemic, were general surgery, general medicine, and oncology.
1 minute.
Yeah, now going into the preliminary findings, basically what I found was that in terms of looking at outpatients, so patients who had not been admitted but who had seen a GP at some point, basically the majority of patients who had contracted COVID-19 were not actually admitted to hospital. That's because obviously in most cases, persons did not require hospitalization. However, once a person was actually admitted to hospital, they generally had a 35.35 higher odds of having been infected with COVID-19 prior to that. Another interesting factor is the fact that most COVID-19 patients spent less than 50 days in hospital, which is a very interesting sign and also indicative of the fact that while the length of stay in hospital might be important, it's not the defining factor in trying to determine what would be included in a long COVID definition. This would be the blue line that you guys can see here, and the jagged line or the dotted line is basically the halfway mark for patients. So 50% of patients basically spent less than 45 days in hospital. Compare this to patients without COVID who basically would spend longer for all other symptoms or reasons combined. Then another interesting thing was the hazard ratio, which I calculated, and this was done by looking at patients who had been admitted to hospital already. And essentially, compared to other diseases, if you were admitted to hospital for COVID-19, you generally had a 9.72 greater risk of having been admitted compared to if you were admitted for some other type of ailment. So what were the most common categories from the ICD-10 that were recognized from the data set, and how did they change during the pandemic versus before the pandemic? Just a note, the COVID-19 code in ICD-10 is U071, and that's going to come in handy in just a minute. So endocrine disorders or hormonal disorders, there was a 1.23 increase odds. Psychological conditions, these increased by 1.29 odds. There was a 1.4 greater odds increase in injuries to the body. COVID-19, like I said, that is U071 in ICD-10 code, and that increased multiple folds during the pandemic. Medical and surgical complications surprisingly increased by 21 time odds during the pandemic. But there was a corresponding decrease in respiratory diseases. This is not unusual given the fact that it was basically seen all around the world. Respiratory diseases, including common influenza and the cold, decrease as they were outcompeted by COVID-19. Arthropathies or pain to joints around the body, joints and tendons decreased as well. That's another interesting point that will be further explored. And voluntary visitations to the doctor, obviously for other reasons, were decreased due to the fact that priority was given to persons with COVID-19. So what are my next steps? I'll just go through this very briefly because this is still very much an ongoing research. So essentially what I plan to do is use survival analysis as well as incorporating regression such as Cox regression into following up patients who had and as well as who did not contract COVID-19 and tracking them up until the point that they do contract COVID-19 and then seeing from that point thereon what subsequent diseases they were diagnosed with, either as outpatients or as admitted patients, and as well as doing the same thing for people who did not contract COVID-19. Following on that, I plan to do a lasso regression to basically eliminate the insignificant or the least significant contributing factors to the outcomes, the outcomes that were recorded or that will be recorded after identifying them from COVID-19. And then following on that, I plan to use a k-means clustering to basically see whether or not these different symptoms which have manifested themselves post-COVID fall into any recognizable patterns. And of course, this will include things such as demographic information of various sorts and seeing what role they play, if any, in actually influencing the outcomes that will be observed. So that is essentially, sorry for going over time, but that is essentially my presentation. Thank you for your time. And of course, afterwards, if there's any questions, I'll be happy to answer those as well.
Thank you.
Yeah. Would you like me to stop sharing?
Yes, please. We'll take questions later. Jamie, happy to do your presentation now? Okay, Adam.
Oh, I think Jamie's still on.
If you are having some difficulty.
Oh, it's not. It's just I'm not used to Zoom at all. And you can't go to share your screen and unmute at the same time, I've just learned. Okay, I will share my screen. Let me just give me 2 seconds. Right, that should be me now. Oh, stop this.
That's it. You can start.
Hey, I can start. Sorry about that, folks. Hi, everyone. My name is Jamie Taylor, and I'm here with my colleague Adam Naylor to talk about accessing Scottish Government data for research. My role, as well as being a senior data protection advisor within Scottish Government, I also manage the Statistics, Public Benefit and Privacy panel. So we're here to talk about the panel, and Adam is here to just give you an overview of the education data sets that are available for research purposes. So just to explain, the Statistics, Public Benefit and Privacy panel is the panel that the Scottish Government has pulled together to look at requests for using our data for research purposes, mostly from universities. So we also look at requests to use census data and data linkage whenever you're looking to link Scottish Government data to, I don't know, health data or any other kind of data. So just a rough overview there of the panel. As part, when applying to the panel, we do look for supporting information along with the application form. Now, these documents are really vital to the assessment that the panel does for requests to use our data for research purposes. But probably one of the benefits of using a SafePod is we also ask organisations to provide their information security policies, home working policies, just to demonstrate to us that there are appropriate measures in place to keep our data secure. That can be ignored when you're looking, if you're using a SafePod, which is quite handy. So just to give you an overview of what to expect when you apply to the Scottish Government panel to access its data, we do look, once an application is received and triaged as being complete and all the appropriate documentation has been provided, we do look to give an outcome within 4 weeks. This could technically take a bit longer. It really depends on what the request is and whether it is low, medium or high risk. And that really depends on the data that's being requested. So for aggregate non-personal data, it is likely, and it's a request for a single data set. This is likely to be quite quickly processed because it can be dealt with locally by the division at tier 0. However, for medium to high risk requests, these applications are assessed at tier 1. That involves, we pull together a panel. We have about 25 members of statisticians and data protection specialists. We pick 4 from the pool. They each do their own independent review of your request. They're given 2 weeks to do that. And then we collate in, me and the Secretariat collate in those assessments. And more often or not, there usually is a consensus and we will issue an outcome letter. The 4 outcomes are below, but I do just talk briefly about them in the next couple of slides. However, if it's particularly sensitive, this is where maybe the focus of the research is on vulnerable groups, such as transgender, children. It may get escalated up to tier 2. That may add a week or so to that 4-week deadline, but we'd always tell you. And we work very closely with projects. We always seek to allow our data to be used for research. We definitely recognise the importance of it. So we'll work with you to get your application through the panel. I have not ever rejected an application in the 2 years that I have been managing the panel. So what's the outcomes? So working down from, we will probably, if there are some remaining outstanding questions around your application, maybe we're not quite clear on what the lawful basis is that allows the data to be shared and used for the purposes that we will come back to you by issuing an additional information required letter, which will detail exactly what's missing from the application. Obviously not approved, as I said, we've not issued one of those in the last 2 years. Approved with conditions means that in principle we agree with your request, but it might just need some finalisation of documentation, in particular a data sharing agreement between us and your organisation. And then the final one is approved, and that means that the data can be shared. The bonus with approved with conditions means that while we're waiting on the finalisation of documentation, the division can then start to pull together the data that you've requested, but it won't be shared until you receive that full approved letter from the panel. There's a whole raft of information available on our webpage, including guidance, and I would advocate please read the guidance when you're filling in the application form, because it really will avoid delays in triage. Make use of our checklist, and we're always here to answer any questions that you may have. The other thing we do expect, if you decide that you would like to use some Scottish Government data for your research, that you really must contact the division that holds the data and discuss with them initially, just to make sure that they do have the data that you're looking for and that they agree in principle to what you're proposing. And I would also highlight that if your intention is to use a SafePod, that you make this clear to them right at the beginning. And now I will pass to Adam. Thanks, Adam.
Thanks, Jamie. Can you click to the final slide? Thanks.
Yeah.
And if possible, can you click on the link below, just to save me having to navigate it? Thanks. So I'm just going to talk a bit about the education data sets that are available. So our aim within education analytical services is really to get as many education data sets in a research ready format as possible through the HDR Scotland process, and we've got secondees in from Research Data Scotland to try and help speed up the process of getting the data updated properly. So Jamie, if you just scroll down on the web page a little bit just to see the available data sets. So an exercise was done a few years ago to get all of these data sets ingested into through Idris into the National Safe Haven, which means that when we get a request for data and the request involves the data sets that are listed here, there shouldn't be much of a delay from our side in terms of having to produce any bespoke bits of data for the research project, because the data is already in and ingested in the Safe Haven, which means that requests coming through that route should be, once the application process is done, getting access to the data should be pretty smooth and pretty straightforward. Before we got data into the HDR Scotland platform, it was very much relying on the resources at the time of people working within education analytical services as to when researchers would get their data, even once the application process was approved. So that could bring in further delays at the end of the process. So if you just scroll a little bit back up, I'll just talk through some of the data sets that are available. So the pupil census data set is the kind of fundamental thing that I suppose it's the sort of basis of where linkage data happens to most of the data sets. That's information on pupil characteristics, and it's based on the Scottish candidate number of the pupils, so that allows it to easily be linked to all the other education data sets. And once it's in the Safe Haven, there's further information about I think date of birth and sex, which has been used to help it link to other data sets, sort of health data sets as well for those kind of projects. And we also have looked after children data sets. That's basically children who are being looked after, whether at home or away from home. If you keep scrolling down. We've got leaver destinations in
left, Adam, okay.
What was that?
Just a few seconds left, okay?
A few seconds left. Okay, well, have a look yourself. We're trying to get more data sets in as well. We're trying to get PISA in. We're trying to get achievement of curriculum for excellence levels in, and health and wellbeing data in as well. So basically, all the data we have in education, we're trying to get on this platform to try and make it as accessible as possible. So that's me.
Thank you very much. Jamie, if you can pop in the chat the data access request form and the checklist, that would be great. And if you can stop sharing so I don't see my face. Thank you very much.
Thank you.
Thank you. Okay, next one is Suhail. I hope you're there.
Hello, can you hear me? Yes, you can see me and
can.
hear me. Excellent.
Fantastic.
Right, let's start sharing. I'm really worried now. I'm going to have some technical problems.
Hopefully not.
Everyone cross your fingers for me, please. Right. Let's make sure I share the actual slides. Your screen is sharing. I can't see what I'm sharing. Is it on full screen?
It's not, but we can cope with that. Oh, okay. Hold on.
Oh, here we go. I think it's showing something. So, okay. Is that working? You can see the slides in slide mode?
Not in slide mode. Maybe you have two screens.
3 screens. Okay, I think
I'm presentation mode from the bottom right of PowerPoint. Bottom right, yeah.
Oh yes, the power of collaboration.
Not that one, the one to the left of it.
This one?
Yeah, I think so. Reading view, I think it's that one. Yeah. You'll need to stop the presentation if you're in one.
The one.
No, it's happened to me as well. I've also fallen prey to the technical difficulties. So
Topic
sorry.
for the next webinar: how to share presentation. Okay.
Yes, some basic training, please.
Teams.
Okay, so we can see this now, yes?
We cannot. You have stopped sharing.
All right, okay. Oh, it serves me right. Right, here we go. Share this. Yes.
It's sharing, not in full mode, but it's fine. Go ahead.
It's fine. Let's work with this.
Fine.
Apologies. I'm so excited to be here to talk to you about Public Health Scotland and our data and how to access it. No one is more excited than myself because I'm the last-minute substitution for Carol Morris. You were expecting Taylor Swift, but you've got me. Never mind. Let's keep going. Right. Let's get to the next slide. Okay. So Public Health Scotland, we're about preventing disease, prolonging healthy life, promoting health. So it warms the cockle of my heart to hear about all this excellent research that we've heard about today, using data for insights to improve people's lives, because that's what we want to do. And my team, Idris, we play a part in Public Health Scotland's goal, and that's through facilitating research, using our data and other data for research in a safe way. Okay, so what data, I hear you ask? All this data. Look at this slide, cradle to grave, all the different data sets, really good completeness, 100% on a lot of them. You can build a really detailed picture of someone's life using this data. Look back, you can do the follow-up, the different kinds of cohort studies, the controls, different things you can do with this data is amazing. And we've seen some of that from the research we've heard about today. So there's a lot of data, and the data sets, more details, you can go to the Research Data Scotland metadata catalogue and you'll find a lot more information there. Okay, so how do we support research? Well, we do it together, collaboration. That's how we do things. No one organisation can do this alone. So we work with EPCC, who run the National Safe Haven infrastructure for us. We work in National Records of Scotland, who are the trusted third-party indexing service for us. And of course, we host data, the ADR Scotland programme. That data sits within the National Safe Haven. We work with Research Data Scotland and launching the Research for Access service, which I think Jen is going to be talking about later. Also, the regional safe havens, it's worth mentioning them because they play a very important and crucial role because they have more local data, and often that data is more granular and more detailed. So this is what we do. Okay, and this is just a slide saying these are the different kinds of insights. This is what we want to do, the insights we want to get to improve people's lives. So that's what we're here for. So we want to support research. So how do we support the researcher? Well, we help with the discovery phase, scoping your requirements, helping you to see what data could be useful for your study, looking at the design, then helping you apply for the data, with the different permission panels, linking the data, provisioning it, giving access to it in a secure environment, and helping with disclosure control so your outputs are safe and ready to publish so you can make the change in the world. Okay, so like I said, there's a few different panels we work with. Statistics, public benefit and privacy panel, just heard from Jamie. Health and social care, public benefit and privacy panel. But essentially, we can support you with lots of different data controllers. Come and talk to us, tell us about your interesting idea, and we will try and help you to make it happen. It's a bit about National Safe Haven, so it's a secure environment, lots of different statistical packages, compute power. There's no end of things you can do in this excellent infrastructure. We host data. We have an area for developmental innovation type projects. The main area for your research, your analysis, we hold imaging data. And if you put an inquiry into us, we will direct you to the appropriate pathway so you have a nice, smooth journey. And the different access routes for the health and social care panel, most health data is accessed remotely. Some Scottish Government data sets need to be accessed via a secure setting. And of course, the SafePods as well. Some contact details. I think that's me.
Thank you so much. So now you can answer a quick question. So does IDRIS give access to data, or would it be RDS if on ADR Scotland program?
So the data holders are the ones who are providing the data. We're the researcher support service. So if you come and speak to us, we will make sure that you get the right support, and the data, whatever data it is, we'll make sure that that data is provided to you and you access the data in a safe way and apply to the appropriate permissions panel. So I don't think I really answered your question there, but it depends on what data you would like, what data you want to access. Best thing to do is pop in an inquiry form and talk to us, and let's work out what it is you need and how we can support you.
If you can paste a link in the chat, Swahil, that would be great, where people can go and access data.
Okay, we'll do.
Thank you very much. Phil, are you ready?
I flipping well hope so. Let's have a go. I really sympathise with Jamie because we live in a world of teams, don't we? So it's a new environment for me. So I'm hoping that might have come through as a full screen.
With your notes.
With my notes, right?
So,
okay, so
center.
There we go. And I need to just go on here to
the first.
I'm going to put my camera on. There we go. That's the last thing. I'm your person.
Display settings didn't flip yet.
Has it come through okay?
No, and your camera is not. Oh, your camera is just loading.
Camera's on. Okay, so have you got the full screen?
No, can you try that again, please?
That work? No?
Maybe it will come through, but are you okay for us to see your notes?
Well, it's not quite the same, is it? We really want to give you a proper experience.
Presenting and do that again.
Just do that on first slide. Are we there? Can we see that?
Just a second, but you can introduce yourself, Phil.
Okay, so I'm Phil Yule, not an expert on Zoom, as is apparent. I'm a program engagement manager working in the integrated data service at the ONS. And what I hope to do today is give you an overarching view of the vision for IDS and also look to answer as many questions as I can in the time allowed. I believe the slides are going to be shared with you afterwards, and any questions that can't be answered will follow up. Is it okay to go to the second slide? You there? I'm sort of working blind here.
That should be there
Yes,
now.
yes.
Okay, so we should hopefully have a mission statement at the top. So our mission statement, so the purpose of IDS is to bring together ready-to-use data to enable faster and wider collaborative analysis for the public good. What that means in practice is helping government to make better use of its own data in its decision-making, reducing as many of the barriers to access to data across government as possible. The IDS is a technology-enabled transformation which brings together index data in a way that is not currently possible from across government and also the analytical community more broadly to better support policymakers. And in doing so, IDS unleashes £1.8 billion worth of efficiency savings for government. The government's investment, its resource and its commitment will enable us as a civil service to become a more data-driven in our decision-making. And in this fast-paced world that we live in, there's a need for a cultural shift, with departments moving away from silos and withholding data, only sharing it when it's necessary, to a much more open marketplace for data. IDS acting as a central repository as such. So a key objective of IDS is to enable faster and lower cost analysis for government through streamlined data processes and departmental collaboration. ONS is the lead delivery partner for IDS, but the platform is a collaborative piece across the government. IDS is therefore a government product. Being cloud-based is truly scalable and fit for the 21st century. We go to the next slide, please. So I've already said IDS is a key part of transforming data sharing across the analytical landscape for the public good. It's driven by the analysis function strategy, the central digital and data office roadmap, and also the national data strategy. It's all about mobilizing data and unlocking its potential for government decision-making and impactful and efficient analysis through innovative tools and techniques. It's all helped by the CDDO's drive on regulating data architecture around the standards and metadata. And we're collaborating with key players in the field of research, so ADR UK, UKRI, ESRC, and onboarding flagship data with associated projects. We're also working really closely with the devolved administrations, the local governments, and academia. So this image illustrates the vision of how we're looking to streamline and transform data for the public good. And the next couple of slides will explain that a little bit more. Get the next slide, please. So let's look at data. So the existing way of acquiring data is lengthy and drawn out, and it can take months, if not years, particularly with data-rich departments like HMRC, for example. Crucially, at the moment within our service, it can only begin when a policy question has been identified. What we're looking to do is to take the data negotiation, the engineering, the linkage out of that linear process and look to do as much as possible prior to policy questions being identified. What we're going to do is acquire key fundamental data assets from across government with a broad analytical scope, engineer them, and then make them linkable via the RDMF, the Reference Data Management Framework. This essentially will allow analysts to link or join index data together themselves using the indexing keys within RDMF. This will be things like demographic, address, geographic, business, and classification where applicable. We're also creating critical assets known as integrated data products in thematic policy areas, which initially include things like levelling up, health, and net zero. And these will be hosted centrally and then shared widely across government to answer policy questions as they arise. These de-identified linkable data assets offer a much more efficient process for rapidly answering policy questions at play. And the strength of IDS comes from its iterative ability to grow over time, creating a richer, more complex and diverse set of data, that is already available and ready to use for analysis. Go to the next slide, please. In terms of technology, IDS is cutting-edge, multi-cloud-based solution. It's our ambition to have the ability to connect to existing departmental infrastructures, offering interoperability across cloud boundaries hosted by AWS, Azure, or Google. Cloud tools such as R and Python are making access to data scalable, sustainable, and user-friendly. An iterative development in the tooling is still ongoing, specifically around geospatial and equivalence to Stata, which I know is heavily used in the academic space. Visualization tools will aid the presenting of outputs, and they will be available too, and will be provided through Looker. Next slide, please. We're using the Digital Economy Act, the DEA, for accreditation purposes, and that will be the enabler of our 5 safes. So the 5 safes framework informs each stage of the user journey, and it aligns to project accreditation, project proposals, enabling de-identified data in a safe environment with safe outputs. All users need to be accredited. At the moment, it's about 4 hours worth of training. You don't need to apply if you already have existing accreditation, which is great, and it's valid for 5 years. Once that's completed, researchers can then apply for access to data for specific purposes through the Research Accreditation Service. And the good news is we've reduced the number of questions on our application forms from 32 questions to 11, and using the early adopters, that has helped to shape and refine that end-to-end user journey, which is supported by comprehensive service wrapping. If you're an existing Secure Research Service user or an SRS user, you'll be aware that SafePods have been available for some time. IDS is currently still in a beta stage and will be replacing SRS on a phased basis over the next 12 months or so. But please be assured that the testing has been completed at a couple of sites already, and we're just going through that final piece of governance and approvals. SafePods and rooms are on track to be available later this year. In the meantime, it's worth mentioning that there are some additional things that are essential in terms of organizational preparedness. Assured organizational connectivity can be described as a good behavior bond, I suppose. It covers the way that analysts access data safely without prying on themselves. This will already be in place if your organization is using SRS already. Cloudflare software allows safe access to the platform, requires a small tweak to your network configuration at the organization's level, but we've got information that we can share in advance and a dedicated team that's. Next slide. Okay, I'll ruffle through this. So I've spoken a lot today about our innovative service and methods to improve data sharing and our game-changing linkage, to name a few, how this is going to unleash that £1.8 billion worth of savings. The linked data gives a much richer picture for analysts. And as we've seen in recent years, quick responses are required to answer different questions. For example, the COVID pandemic. So in the heart of all of this, and the fundamental reason for the investment in IDS, it's simple. This scalable, transformative and trustworthy service, proofed against future demands, will allow a large user base to undertake impactful projects, making more efficient and effective use of government data for the public good, improving government decision-making, and ultimately improving people's lives. Last slide, please. So thanks for your patience in listening to me today and my Zoom technophobia. We hope that's given you an overview of the IDS vision and where we are now. Please subscribe to our newsletter. It's a great way of hearing about updates and developments, and information is also available on our website, which is the integratedDataService.com. That's the end. Thank you.
Thank you very much, Phil. I know Katie is back and she's very keen to restart chairing this meeting. So, off you go, Katie.
That's perfect, right. Bear with me, I think is it Jen next? So Jen, if you want to share your slides for me.
Sure, I will do my best. Okay.
And just whilst you're doing that, I'm just going to thank Serena for stepping in so that I could nip across and do an awards session and get back. So thank you very much, Serena, for holding the fort. Perfect, Jen, we can see your slides, we can hear you, you're good to go, thank you.
Fab, and that's coming up as slideshow. I don't need to do anything, great.
Yes, Jen, that's great, no issue. You go on.
Fab. I don't know how I managed that, but here we go. So hi, I'm Jen Campbell. I'm the Digital Delivery Lead at Research Data Scotland. So I'm going to be talking today about our Researcher Access Service, which has been mentioned in a couple of the earlier presentations. So just be giving a bit of a brief overview of what that is and what's happening with it at the moment. So what is it we're trying to do? The aim of the Researcher Access Service is to make it faster and simpler to access data to support research in the public good, which I think ties in with what a lot of people have talked about already today. The service that we're building will operate securely, lawfully, and offer an improved end-to-end experience for front and back-end users while reducing errors and duplication. So that's the kind of overall vision that we're working towards for the Researcher Access Service. In terms of the kind of journey that we're talking about with this new service and what is it that we're trying to kind of transform, it does kind of take in that right from kind of discovering what data it is that you might want to use for your research through to the outputs. And this slide here just kind of flags some of the bits that we're aiming to improve through the development of this service. So starting kind of over at the left-hand side, starting to build up better information about data and processes that you need to follow to access that data, working towards more of a single entry point for users, you know, for data that can be accessed through that route. Going into inquiring about data, having a risk-based triage process so you can determine which pathway you actually need to go down to access that data, a digital application process. Suhail mentioned earlier that we work closely with Public Health Scotland's IDRIS team, so they would be continuing to support the application processes, offering kind of tracking and feedback throughout that process and through the approval processes. Access via the National Safe Haven, and finally transparent use and published outcomes is something that we're kind of looking into as well. So that's the kind of overall scope, I suppose, of things that we're trying to work towards at the moment on the Researcher Access Service. But you might be wondering kind of what's happening now, what is it that might be changing in the near future. So what we've been working towards over the past kind of 6 months or so, but also with lots of kind of pre-work before that, is really our first release of the Researcher Access Service, Release 1. And that will offer an end-to-end digital journey for researchers for the first time. It will offer a simpler approval process for the datasets and the projects that fall within the scope of this service via a panel made up of PHS and RDS people rather than the full HSE public benefit and privacy panel that these projects would go to at the moment. It is supported by the IDRIS team as projects would be at the moment, and it sits alongside the existing approval pathways. And at the moment, what we're able to offer is access to 9 agreed data sets, which are listed there, and it includes some of the most commonly used health data sets, as well as birth and death registrations. So at the moment, if your project was to fall into those data sets only, and it met some other criteria, then you may have the opportunity to go down this simplified route. And this is just this kind of first release, the first version of the service that we're bringing out. And just to reiterate that in this case, to be within the scope of this service, the data would be accessed within the National Safe Haven. If you were wondering kind of, how do I know whether this pathway is right for me, whether I go down the existing routes, how do I decide, do I go to IDRIS, do I go to RDS? You'll hopefully be pleased to know that we've tried to keep that really simple. We've kind of talked here about 2 pathways. I know there are other pathways you could go down for data access, but in terms of kind of the IDRIS support model, there's 2 pathways, but 1 entry point. So what we have on the RDS website is initially some kind of high-level eligibility questions. And given that the scope of IDRIS's support is quite broad, as Suhail mentioned earlier, those are really quite high level. So it's really just confirming that generally speaking, you're in the right place. You're not looking for something completely different, like for example open data or published statistics or something like that isn't what you would get through this route. Assuming that's not the case, you would come into the inquiry form, and it is a single inquiry form for that IDRIS support. Once you filled that in, then the triage process would determine whether your project is suitable for the new pathway or not. If it is, then you'd be triaged in and you would go through the new approval panel. If not, you would continue down the kind of existing pathways that exist as Suhail outlined earlier. All of those could potentially at the end result in access to data in the National Safe Haven. So I'll just very quickly show a few kind of screens just to kind of bring it to life a little bit of what it is that we've developed. So this is just a view of kind of the start of the initial inquiry form. I'll not go through it all because it's a form, but it is quite a short, fairly brief form. It gathers really just the information that's required to make that triage decision and understand which pathway your project is appropriate for. In some cases, so if it's a relatively simple project, if it doesn't have lots of different factors that need to be considered at the triage stage, then we are able to offer a kind of on-screen cost estimate, which was something that we heard from researchers was important. It can be really useful to get an indication really early on without any kind of waiting time of what the cost estimate would be, because that can help with things like funding. We will over time kind of try and build that out so that we can offer that to kind of more and more kind of scope of projects. If your project is then triaged into the Researcher Access Service kind of current scope, then you would be invited to start your application using this online platform. So this is just a kind of view of the kind of home screen there. So that's a test application there. I could click into that and kind of fill out my application. I could save it. I could come back. I could go away. I could also communicate with the EDRIS team through this service. So I can leave comments on my application. I could say, you know, I'm not really sure how to fill in this bit. Can you give me some help? This would also be where you would complete any tasks associated with the approvals process. Like, for example, if you need to upload a user agreement, or further down the line, if you need to upload a purchase order, you would do that through here, and that would appear as a task. So just before I close, I just wanted to say a wee bit about our approach, just to kind of explain why we've done things the way that we have. So we've taken an agile delivery approach where we're focusing on delivering value as early as possible and learning from real users. So that's why we're kind of going live with this sort of limited scope initially, that we'll then build out over time. We don't want to wait until it can offer every single data set and every single kind of functionality that you might ever want. It's really good to get it out there, start seeing people using it, and hear from people on what we can do differently. So we're starting small, we're testing and learning, and we're building out the service incrementally. We've worked really closely with the EDRIS team throughout the design and build. They've been embedded in the team and helped us to shape it to ensure that it meets all the kind of needs of the process and the needs of the research coordinators and data analysts and all the other people that support the service. And we've been guided by user needs, and that has included doing user testing with researchers. We did a round of user testing earlier this year, which gave us some really good pointers to improve our form and improve the service. And in terms of next steps and future plans, so we're kind of rolling out the first release at the moment, and then we'll continue to develop and improve that post-launch based on user feedback, so based on what we hear from the people who actually use it in real life. We're also seeking opportunities to expand the range of data sets that are available through this pathway, and to map out the approach for other organisations and other data controllers who might want to onboard to the service, so that we can continue to expand the scope.
1 minute.
That's actually me. I've gone a bit faster than I expected, so yeah, happy to take any questions.
Perfect. Thank you very much, Jen. That was great. Now, keep me right, Serena. We've got one more talk to go, haven't we? We still got Antonio to go?
No,
we're done. We're all done.
Questions.
Just questions. Okay, so we have 3 minutes. If people are able to stay on a little bit longer, do people have any particular questions? I've seen that a few in the chat. Obviously, there's a big question around costs, and Suhail has very helpful put all the links in. And I think, Darren, can you just confirm around costs for SafePod? That's all done through the individual data providers? Is it?
SafePods is completely free.
Yep.
Yeah, free for booking and free for use. Yeah.
Yep. Okay. What else have we got? If anyone wants to put a hand up and ask a specific question, you can do that as well. Any other questions? Go for it, Ross.
Hi, I popped the question in chat before, excuse me, which was about the IDS stuff. at the moment, I'm in charge of our organisation's SRS agreement. So I was just kind of wanting to ask, what that replacement looked like. Is it a case of when we come to renew our AOCs and our ACCs, we're just updating them to the new documentation and filling out the conversion form, or is there like a cut-off date where things are expected to be done by? Just generally what that space looks like.
I'll try to answer that in the chat, really, but my I don't know if it came through to you there, Ross, but yeah, so the AOC agreements are pretty much the same between SRS and AOC and IDS. We're not looking to change anything dramatically. There is obviously that renewal sort of process, but as the transition happens over the next 18 months or so, as organisations, depending on what projects there are and what have you, our team that are dealing with that will be in touch with you, and we'll make it as seamless as possible. But essentially, there isn't a great deal of change in those agreements. So yeah, rest assured, we've got that covered, hopefully.
Cool. Thank you very much.
Perfect. So I'm not seeing any additional questions apart from one for you, Darren, and that's why is the St Andrews SafePod categorized differently?
I'm not sure what that means when
Okay.
it means categorized. I mean, we did have a.
I meant in your. Sorry, I'll just clarify because I know it's meant to be coming, but it's been very cagey about what's happening. And like, at the start, you had like there's 23 SafePods, and then St Andrews was mentioned explicitly. That's what I meant about categorized. I think it's because it's not fully open yet.
On my slide.
Yeah.
Ah, right. Okay.
Like, is it ever happening? Is it?
It's installed.
Yeah.
It's installed. So we're just going through the setup. It was installed 2 weeks ago. So we're just going through the setup phase. So hopefully it'll be ready for you next month.
Okay, so it's just not live yet, and it'll be ready for back in hopefully in the next few weeks. Okay. I am really mindful of time. I want to thank all the speakers that we've had on the call. I really want to give a big thank you to Serena and Rebecca for organising this, along with Darren as well. I found it really useful. I hope you as researchers have found it useful. I know there's been a few technical issues and we apologise for that, and we will reflect on that. But if there is anything that you would like to see, we will be in contact afterwards. And like I say, some of the questions they've put into the chat, we'll combine them and put some answers around. Serena, was there anything that you wanted to add?
No, that's it.
Okay, so thank you very much, everyone. We're 1 minute over, but otherwise we're on time.
We won't quibble about a minute, crikey.
We're not going to quibble about a minute. It's been brilliant. So thank you very much, everyone. It's been lovely to see you all, and we will be in touch. And if there's anything that you do need, make sure you're signed up to the HDR UK Scotland mailing list, and there's a feedback form that's just been posted as well, and we will be in touch. But thank you very much, everyone. Enjoy the rest of your afternoon.
Thank you.
Bye.
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 Thank you. Bye.